Minnesota health officials say we may be starting to see the impact of COVID-19 exposure from the Thanksgiving holiday. Today, they're reporting 61 Minnesotans died from the virus and nearly 5,400 new cases of COVID-19.
Planning is underway for when the COVID-19 vaccine will arrive in Minnesota. State health officials say they still don't know how many shots they'll be getting, but they have a better sense of the timeline.
We do anticipate beginning to vaccinate before Christmas. And how quickly we can get through that, that priority 1A group will depend upon the volume that we don't yet know for sure is coming.
During an online forum this morning, Minnesota Senate Majority Leader Paul Gazelka said people who work at the Capitol should be a priority group for the vaccine. The Republican said that he would encourage people who are essential to be at the Capitol for the legislative session to get vaccinated after frontline workers and the elderly. First on the list for the vaccine, long-term care residents. State leaders warn that community spread is impacting those facilities and the ability to care for the people who live there.
Governor Tim Walz and others shares what is happening with our most vulnerable Minnesotans. WCCO's Jennifer Mayerle found out what's being done to keep them safe.
June England lives in independent senior living in Minneapolis. The 94-year-old says she's keeping busy at home and feels safe getting tested for COVID weekly.
They come to our door. And they come with masks and they come with gowns and gloves.
But she worries about others who require more contact with healthcare workers exposed in the community.
There's concern because they're the most vulnerable of us.
The state raised concerns, too, saying rampant community spread is making its way to long-term care facilities and impacting the ability to staff them.
Crisis starts to become what happens when everybody in a care facility is not there to work? What happens to the people who are living in it?
Health Commissioner Jan Malcolm said the state has helped upwards of 3,200 facilities with infection control measures and expanded testing for staff and residents with roughly 60,000 per week by late last month. But care facilities say the community spread threatens the safety measures.
We've got over 200 residents and team members that are positive for COVID, and we're relentlessly trying to contain it.
The National Guard implemented a plan to train non-medical soldiers and airmen. Nearly 300 are working as temporary nurse aides with long-term care patients.
The state has run out of trained professionals to fill these critical roles and serve and care for our most vulnerable populations. They understand right now they have a mission for the greater good of Minnesota.
June says she'll continue to stay home and FaceTime with family while giving thanks to the National Guard and all those who show up day after day.
And I think we should be very appreciative for all of the people who are willing to work with this dreadful disease.
Jennifer Mayerle, WCCO 4 News.
And we've heard this for months now, but health leaders pleaded again with people today to help by wearing a mask, reducing contact, and maintaining a safe distance.